It's the place we turn to when we're most in need, but more and more A&E departments are turning patients away. In the last year, the numbers forced to shut their doors has risen by a quarter, with experts describing some hospitals as war zones. The latest to come under fire is the Royal Liverpool. It spent Monday morning sending patients to neighbouring hospitals, with queuing ambulances locked out for well over an hour. But hospital staff here say they simply had no choice but to turn patients away. They put the increased demand down to an especially busy bank holiday weekend. But it's not just medical staff here that are struggling to cope, with doctors across the northwest warning that many A&E departments are at tipping point.
It's quite busy at the minute. We've got one empty cubicle.
Staff at the Leighton Hospital in Crewe are trying to get that message across. Shadow Health Secretary Andy Burnham heard it loud and clear.
Last winter we saw an unprecedented increase in demand of over 8%. We have opened additional capacity in the hospital to deal with that. Our concern going forward is winter approaching because we couldn't deal with another 8% increase in activity.
We do still have occasions when all of our 10 cubicles here have patients in, and whilst patients are being continually assessed, they are sat waiting at times on the corridor or in the waiting room. And nobody wants to deliver care that way.
But the sharp rise in demand is not easily explained. Some point to a lack of weekend access to GPs, others to a lack of hospital staff. The Labour Party is calling on the government to ease the pressure, but staff here say that pressure has long been building, a point that I made to the former Health Secretary.
Oh, of course, some of these things, go way beyond individual governments. There's pressures of an ageing society, and more people have been coming through A&E. Some people coming to A&E for the wrong reasons, and we all have to do a better job of educating the public to say, look, this is a very valuable resource. Please don't come here if you don't really need to.
A solution is certainly needed, because regardless of who's to blame, it's a problem which affects us all.